Jonah, let's start with Biden's health care initiative for underserved communities.
Well, as we just celebrated another Thanksgiving in this COVID era, we think about the more than 700,000 Americans who have died. And why has America suffered so much? Well, Americans are inherently unhealthy. And why are they unhealthy? Because a good part of the country is obese. And why are they obese? Many of them don't have access to adequate health care. They don't have good fitness. And why don't they have good access to health care? Well, in many marginalized communities, there just isn't. I mean, it's a business model, what we have for healthcare, for better or worse. They don't have the money to support more nurses. They don't have the money for the education. They don't have the money for the student debt. And so what the Biden administration is doing, and they're using part of the American Rescue Plan, is to devote about $1.5 billion to try and shore up some of this access and basically the supply of healthcare professionals to these marginalized and underserved communities. And how do they do that? A lot of the money is for scholarships. It's not so much of a job shortage, it's a skills shortage. When we talk about people not applying for jobs, there aren't enough nurses, there aren't enough EMTs, paramedics. It's a skills shortage. You can't just come off the street and get these jobs. You have to have education. You have to have certification. You have to have a graduation for these very specialty positions. And if you don't have access to those classes, if you need to take transportation to get there, that's tough for people who are in poor areas or where things are very far apart in rural communities.